with Dr. Lee. Join your host, the accomplished Dr. Cherilyn Lee, as she welcomes the leading experts in health and well-being as they explore the advancements in natural health, physical fitness, nutrition, integrative medicine, and self-discovery.
Good day or evening, everyone. Again, as always, we come to bring you edifying knowledge. And what shows that we do too, we want to keep in mind is early detection, prevention, and my motto is, I test and not guess. We test and assess. But prevention is the key. This is why we're doing the show today as we are doing. But there's so many myths out there on so many diets. And there's so many people who are vegetarians, and I know I've had a lot of calls from friends I know who are vegan. And so today we're going to give you the facts about vegan diets. The facts. This is research facts about vegan diets with my guest today, my distinguished guest, David Getoff. Thank you.
You're welcome. My pleasure.
And again, can you tell people a little bit about yourself?
I'm a traditional naturopath and board certified clinical nutritionist. I've been in practice about 28 years. I mostly see patients all day to help them to help their bodies to correct and get rid of, if we can, completely, as many different conditions as they come to me with, which is everything you can imagine.
Yes.
And in my free time, which doesn't quite exist, I wrote a book, Abundant Health in the Toxic World, and I lecture at medical, dental, nutritional, and agricultural conferences around the United States. And then I take time whenever I can, because I love to educate, to come on shows like yours.
Thank you.
Help hit a bunch more people.
Thank you. And you just don't know, I had a lot of calls of people who saw you at Cancer Control. Mm-hmm. And so they were really happy to tune in today. So please get your pen and paper ready to take notes. And please start sharing the show right now, because the information that you're going to receive is going to get, my prayer is going to give you a better quality of life. And that's what it's all about, the best quality of life. So I want to thank you. I want to say doctor all the time. David Getoff, for being my guest today. And again, so we're going to jump in, because you and I, every time we talk, we never can complete everything.
Right.
So I'm going to have you on again. I know. Okay. I know you're going to be on again. But we're going to start with our topic today is on the facts about being vegan. So let's talk about, before we jump into that, let's talk about the number of diets that are out there now. And there are so many. There and so many myths. Then we're going to kind of get into the facts on the being facts of being vegan. Okay.
One of the reasons that there's so many diets out there is because authors either know or have been told by their publisher that if you turn your book into a diet book, it'll sell more. It's really interesting. I mean, I have people
so sad.
That they had one topic and they instead made it a different topic because it was going to sell more books because they were talking about diet. So you've got the vegan diet and the vegetarian diet.
So then what happens to the consumer? They're listening to these.
Oh, the consumer. No, who cares about the consumer? They only want the consumer's money.
Oh, that is so sad.
That's really the caring. I mean, the purpose of the consumer, as far as business is concerned, is to keep the businesses financed.
Okay.
So yeah, we got lots and lots and lots of different diets, with probably the main diets that get talked about the most being a SAD. I love that one, SAD, Standard American Diet.
Exactly.
Great acronym.
Yes.
And then you have people talking about the vegetarian diet, not realizing that there's lots of different vegetarian diets.
Exactly.
And vegan diet, which a lot of people don't understand, but we're going to be talking about it, and that's pretty specific, and we'll go over that.
Yes.
And then we've got one which is completely bogus, and that's the Mediterranean diet, because one of the investigative journalists that took a look at all the different parts of the world that are in the area that is called the Mediterranean region found the diets to vary so horrendously much.
I can
that
imagine.
There is no such thing as a Mediterranean diet. And she said nobody should be using that term because it depends on which part of that area you decide to point to. And yet people use it all the time, even though there isn't any such a thing.
Right.
So then it becomes whatever somebody thinks that means.
Oh, my goodness. And people say, well, I'm on my way to a Mediterranean restaurant, and I'm having a Mediterranean diet. So first of all, they think really of vegan almost. Sometimes.
Yeah.
And then we have the Pritikin diet and the ketogenic diet.
Right.
And I had some people tell me
Paleo. Yeah.
the paleo diet.
Right.
That's what I meant to say. But on the ketogenic diet, that is really, now they have ketogenic bars and drinks and shakes. I mean, and I tell
Market
people
to the public and make money.
I said, this is so sad, not because of the American diet, but this is so sad that people will do that. And people will call me and say, well, I'm going to do the, I had a couple of patients who said, I'm doing the ketogenic diet. I said, I really don't advise you to do that. Based on your lab tests, which we're looking at the optimum functional level, you're not a candidate to do that. She did it anyway, and it threw her into a horrible spin. Yep. But the thing about it, she not only started it, she started a group of other people on it. And they all start having problems. And I said, you can't, diets and food is meant to eat in proportion, and we need to have a variety. But this is what you're eating and make sure it's clean as possible.
Yep.
But let's just jump right into our topic here.
Okay. Well,
Okay.
I mean, basically, when somebody says a vegan diet or somebody says I'm vegan, what is normally being said is that they are eating nothing of animal origin.
Right.
Some people have specific words they use, like I've heard some vegans say, I won't eat anything that ever had a face on it or came from something that had a face on it. And that's
I hear the ones. This one doctor had a program, and he wanted people to eat meats. He said, eat everything that have eyes.
Right.
Yeah.
Okay. Well, you see, that one's probably a healthier diet.
Yeah.
But we'll go into that.
Yeah.
But I remember hearing somebody say that, yeah, anything that ever had a face on it or came from somebody with a face on it. And I remember somebody in the room said, so you wouldn't use honey then because bees sort of have a face. And the person said, of course I wouldn't eat honey. Honey is not any good on a vegan diet. And then, of course, some other people will say, no, honey doesn't matter. That's an insect. So even when you give a specific name like vegan or paleo, or whatever, you'll have a bunch of people that have different beliefs on what it means or different beliefs on what they want it to mean so that they can not cut out things they didn't want to cut out when they were on that diet.
Oh,
But
okay.
basically, the vegan diet is nothing of animal origin. And
Exactly.
I'm not going to
Exactly.
put insects in there, but some people will.
Yeah. Well, yeah, I kind of had a problem with the person, and she was saying, no, I'm vegan. Even when I came to use a piece of tape on her skin. No, you can't put the tape on my skin. I said, but your husband is not vegan. So his sperms are not vegan. Okay.
And his saliva, if
So
they're kissing, are
stop
not
telling
vegan.
me his sperms are definitely not vegan. So let's not go into all that.
Yeah,
and be
that's
that
an interesting
technical.
point. Nothing is coming into my body that is animal origin. That means you'll never get pregnant. You made a good point there. I like that. His sperms, I like that a lot. I will remember that.
Okay. Yeah, so people need to keep that in mind, and especially if they're dating or with someone who is non-vegan or vegan.
Sure. And of course, if they
Yeah.
have a child, every research study that has ever been done to look at this issue finds that the longer the child is exclusively breastfed with no other food or liquid of any kind coming in, the healthier the child will be for the rest of its life. And the longest one they did was 9 months. When I spoke to the doctor that did it, I said, why did you stop at 9 months? I bet 12 months worth of exclusive breastfeeding would produce even more long-term health.
Exactly.
And he said, I'm sure you're right. We had funding for 9 months.
Oh my goodness. Yeah, all of my just about all my grandchildren were breast. I have 10.
Right.
10 grands.
So hopefully, but I don't know, hopefully a vegan that gives birth will allow their child to be breastfed, because that sure as heck isn't vegan.
No, it isn't. No, it isn't. And I know a couple of people who are watching are grandparents who are having really serious problems with the family because they are vegan and they want their children to be vegan. And now the kids are really suffering because they pulled everything out. They're not getting the right nutrition. They're not getting their B12, their folic acid. Nobody's doing lab work, so nobody's watching anything.
Right.
And even their growth and stature is not being
Retarded.
developed.
Yep.
Is retarded because of the diet. So when I tell a person you want to go make a drastic change, and at the first of the year, which is coming up soon,
Yeah.
people are going to say, you know what, I'm going to go vegan. And so we're not knowing that there's certain things now that are going to start missing from your diet, and forbid that you're taking medications. that's already depleting nutrition from the body in the first place
Right.
because you're taking meds. And if you're taking meds, it's going to deplete some of the nutrients from the body. Now you're going to go vegan. You're going to get everything off balanced.
There
And
are
then-
even people that have a cat or multiple cats, and they put the cats on a vegan diet. And a cat is listed as an obligate carnivore. They're supposed to be eating nothing but meat. I mean, my cats are 9th generation raw meat. But to put an animal that's an obligate carnivore on a vegan diet because you choose to be on a vegan diet, that's just really, really bad. I mean, do you hate your cat that much?
Oh my goodness. Let's talk about a little bit more about the ketogenic, because we know kind of what's going on there. I mean, it's so out there. And what is your take on that?
Well, the ketogenic diet was developed many decades ago by somebody that probably looked into the idea that our nerve cells love fats. The myelin sheath is bathed in fats. The brain loves fats. And they wondered, because at that point there weren't any anti-seizure medications that had been developed yet, they wondered whether or not maybe a very high-fat diet might help people with epileptic and other seizure disorders. And so they started bringing in, large amounts of butter and ghee and coconut oil and lard. And sure enough, there were massive benefits. Some of the people's seizure disorders totally went away. And so that became adopted as one of the methods of treating a seizure disorder or an epileptic disorder, was the ketogenic diet. Then later on, when the medical profession was steered in the complete wrong direction by bogus research by Ansel Keys, that there was something wrong with saturated fats, they switched over, and if they were going to give somebody some fats for a ketogenic diet, they gave them the ones that are really, really bad for everybody, that should be outlawed, like GMO soybean oil and canola oil and corn oil and all sorts of other different things, and they didn't get all the same benefits. Well, yeah, they weren't giving the oils they should have.
Exactly.
And it fell out of favor, both for that reason and because they developed drugs that were anti-seizure. And why would anybody use something non-toxic when there's a drug available?
And if you check the PDR on some of the seizure medications, some of the side effects are seizures.
Seizures, yes.
So you can take a seizure medication and the side effect is seizures.
Oh, yeah, well, there are a number of asthma medications where the side effects are asthma, worse than
Right.
asthma, yeah.
Most definitely.
So you said, what are my thoughts on the ketogenic diet? The ketogenic diet, when it's done correctly with the right kinds of fats, seems to be very helpful for a fairly large percentage of people with cancer, because you're cutting off the food that the cancer cells want because they eat sugar, and you're going to give them ketones instead.
Right.
And so that's very good for cancer patients. It seems to be very good for diabetes, because the same thing is the issue is sugar, and we're going to get our energies from fats instead. So it's great for diabetics. Seems to be very, very helpful for some people with resistant weight loss. They've tried all sorts of other things with somebody that knows what they're doing, and they still aren't losing weight, so they put them on a ketogenic diet. But a lot of the people that believe they're on a ketogenic diet are not, because if you don't
That's what the problem was.
Right, if you don't have a blood ketone meter, the urine sticks are very inaccurate. If you don't have a blood ketone meter, and either find a couple of good books and read them, or work with somebody that's a specialist to find out what level of ketosis you need to be in and why you shouldn't be buying ketones and drinking them. You want to do it with your diet.
Right.
If it's done correctly, I think that it's great for those particular conditions, but I have not been able to find a traditional population anywhere on our earth that was on a traditional diet that would have been classed as ketogenic, and therefore I don't consider it to be a healthy long-term diet if you're not using it for one of those medical reasons.
Right, and that's what happened with one of the parties. He was on a ketogenic diet and wasn't doing it correctly, and it caused some really horrible side effects. I say side effects because it wasn't favorable.
Right.
So I try to let people know, if you're going to do something like that, I mean, get your lab work done. First of all, before you start jumping into diets, know where you are. Get a baseline and know where you are. So micronutrition testing to me is very important, along with your other tests, and find out what your homeocysteine and C-reactive protein, and, your inflammation markers, before you just jump into something, because you could be offsetting. Know what your anemia panels are, before you start doing all this.
You cut out all of your iron when you didn't realize you were already dangerously low on iron. Now you make it worse. Yeah.
Now you made it worse,
Right.
and you wonder, why am I dizzy? Why am I this?
Yeah.
You need iron for so many things, and to know what those things, what's going on with the body, cardiovascular, brain, neurological. We look at the B vitamins. You have cut so much out. Why go get a B shot? And other people tell me, well, I could just come in and get a B12 shot. Well, I do IVs as well.
Right.
And we kind of have one we set up for the people who want to quote unquote be a vegan, so they can get a little bit more nutrition. But this is after you do extensive blood work. We test, don't guess.
Methylmalonic acid to check your B12 level.
Yes. So we want to know what's going on there, everything in the body before telling you need to supplement or tell you about a diet. A diet is your lifestyle. This is nutrition going into your body that should be sustaining your life.
Yep.
So
and
you
anybody
wanna
with a
know.
neurological problem, any neurological problem, should never be on a low-fat diet because the nerves
Oh,
love
no,
fats. So you
never,
get somebody
never.
that's got, let's say, multiple sclerosis, you know, and somebody put them on a low-fat diet because it's healthy for everybody. Well, actually, it's healthy for nobody, but it really isn't healthy for them.
No, not at all. So what are some of the nutrient values as a nutritionist yourself are you looking at for people who are vegan?
Well, certainly I'm going to do methylmalonic acid, which is the proper way to test for B12.
Yes.
I want to take a look at their level of EPA, eicosapentaenoic acid, and docosahexaenoic acid, DHA, because those are two required by the body fatty acids,
Exactly.
which are predominantly in animal foods.
Yeah,
You know,
and I
deep water
just want
fish.
to let people know that you can, because sometimes if you go to your primary care or if you're a member of an HMO, you might not get them to do those blood tests. But you can go to lifeextension.com and order those tests yourself without a doctor's order. So I always tell people, go to lifeextension.com, order those tests. I like to see people do the whole panel, do the
Sure.
male panel,
Yeah,
females
male
do the
panel,
female
female
panel, but add these other things to it. And then the base depends on what's going on with you. You know, if you have, unfortunately, cancer, you want to know what your zinc copper ratios are. Those things are very important, and you want to maybe do an anemia panel, the ferritin, your fibrinogen. You want to test all the different keys to see what is going on. And then the micronutrition, I like SpectraCell.
My favorite micronutrition is the Cardio Ion panel
Okay.
from Metametrics. It was bought out by Genova, so it's now through Genova.
Oh, that's right. It has
But it's
changed.
called Cardio Ion. And for people that just want to look at their fatty acids, but they don't like getting blood drawn, if you go to grassrootshealth.net, which is an organization that's been doing vitamin D research for years and years and
Wonderful.
years,
Okay.
they are now letting you order direct from their website blood spot, pinprick, essential fatty acid tests. So you can
Really?
do that at home and send it
Wonderful.
in, which is great.
Okay, let's give that out one more time. People, take notes.
Yeah, grassrootshealth.net. You can get a blood spot pinprick that you can do at home and send in for vitamin D, for some essential fatty acids, and you don't even have to go in someplace and have somebody stick your arm and draw your blood.
Okay, well, at least you'll have that. You'll have those results.
Yes.
Now, what is, there's so much research, the research I have seen in the past on the vitamin D 25 hydroxy
Right.
blood test should be 60 and over.
I've looked at a lot of the research studies. I've listened to Dr. Voigt, Dr. Hollick, Dr. Cannell, John Cannell. I've spoken to a bunch of times, the head of the Vitamin D Research Council. And what I try to tell all of my patients I want them to hold their vitamin D level in is 60 to 80 nanograms
60 to
per
80,
milliliter.
that's what I
And
said,
I always tell
yeah.
people that's the United States. Nanograms per milliliter is the United States. If somebody's listening to our broadcast and they're in a metric country, whether it's Europe or Canada, they don't use nanograms per milliliter. They use nanomoles per liter. And so 60 to 80 becomes 150 to 200. So you have to know which one it is. I'm talking
Yes.
about the U.S. value of 60 to 80 is a good range.
Wonderful. And that's what people need to know. Because we know if you keep your levels, I have several patients that thought they were in the sun a lot. And because they were in the sun, and the sun being the precursor, that they would, their levels would have been higher. So they was very shocked that it wasn't as high. So
Yeah,
I
people
said,
think the sun is really going to keep your D up, and it doesn't usually do that.
It doesn't.
Because we were designed to be in the sun all day long without clothing outside. And now we're covered up all the time inside, and even the people that have some time in the sun, it's not enough.
I don't think we're going to be out naked in the sun. Sunbathing. I mean, they do have camps for that, but
yes, B12, EPA, DHA, and we have another problem. So if somebody runs a test to look at their methylmalonic acid level for B12 and to look at their EPA and DHA, and they get the test back and they go, yep, my EPA and DHA are right in what they call the normal range. I make a joke in my classes and I say, currently in the United States, the normal causes of death are heart disease, cancer, and complications of diabetes. So
Normal.
let us strive not to be normal. Let us strive to die of old age instead. So I don't want to be in a normal range for a nutrient. I want to be in the upper 20% or up to 20% over for that. And therefore, I will look at somebody's EPA and DHA, and maybe they're vegetarian, and the doctor says, oh, yeah, you're normal. And I go, you don't want to be normal. We want them higher.
Exactly. And this is what I do. And this is what I say, too, on the normal. What you just said, you want the optimal.
Optimal.
There's an optimal range, not normal. Because like you said, the normal people are the ones that normally. and that's sad.
Yeah.
That is very sad.
And how can a diet, the vegan, which we're talking about, how can a diet be a healthy diet if you need to supplement to keep certain values in a healthy range? And the answer is it can't.
My daughter would love you. She is a nutritionist, my youngest daughter, and she says, I don't like to put anyone on supplements. I want them to get it all through their food.
Good luck.
And I said, let's try to get it from my food. Well, she tries. She does a very good job.
Okay.
She does a very good job, but we do add some supplements because it's not going to be there in the quantity that we want.
Well, in my book, I had to give it a name. So I said the basic 7 are the supplements that I find nobody is able to get enough of because of the combination of the quality of our food and all of the inflammatory things that were around all the time, making our body need even more than it used to before we had those around. And so when you have a higher need and a lower supply, those are the basic 7. The basic 7 that when I lecture on basic 7, that's a high quality, high potency multivitamin, multimineral. That's number 1, which cannot be a 1 a day because it won't stay in your body all day. It's got to be
one a
taken
day
with
is
breakfast
fillers,
and dinner.
fillers.
It has to be breakfast and dinner. It's got to be at least twice a day. So multivitamin and extra A, C, D, E, fish oil, and a probiotic. Those are my basic 7.
Okay.
And I find that it's very rare that somebody doesn't need all of those to get into the optimal ranges. If they eat liver once a week, they don't need any A. How many people do you think that is?
Yeah, well, they're going to say the liver is toxic. I mean, it's a detoxing part of the animal's body, so why would I eat something that's detoxing things from the body? Now, it's amazing you brought up liver because I've had several patients that needed blood transfusions based on what the hospital had given them. And one lady was so bad that they was going to send out the PET team to go pick her up because they said either you're becoming psychotic because you don't have enough oxygen going to the brain because that's what's carried in the red blood cells, or you're going to have a heart attack because we need it for the heart as well. And so I said, well, she was a vegetarian. So this was very, very hard.
Yep.
I said, I can give you this recipe. And this recipe has worked for many years with me, with patients. And it was kind of a given. But it's dandelion and it's rosemary and it's beet stem and a little bit of the beetroot. And when I say all that, maybe a little peppermint, fresh peppermint. This is all fresh. But when I get to the 4 by 4 inch of raw liver,
yep,
that has to go in the blender.
Yep.
And the only side effect when I did this,
health.
Improved health, but the hair grew an inch a week. The hair grew 1 inch a week. The beautician was saying, what are you doing? Your hair is just growing, growing, growing. But this is one lady that could barely walk into my office, and 3 days later, she is on a bicycle riding up and down the beach.
Body's amazing, and its resiliency and ability to bounce back if you give it everything it was deficient in.
And then one was a young child based on religious purposes. It was no meat. He was vegan. And I said, well, he had a surgery and they punctured his liver by accident. And he came in the office in a wheelchair. And he was in bad shape. And I told the mother, she said, we do not want a blood transfusion. We don't. And I said, well, either you can do this or he's not going to probably be around because it's dropping very fast. And they were able to do this diet. There's a couple other herbs in it. I call it my anemia drink. And so, and in 2 days, he was playing basketball with his friends, 14 years old.
Yep.
And I said, it's not a lifetime, but you got to get his body back into healing mode.
Yep.
Get your body back into healing mode.
Yeah,
So
I actually had a family that called me up many, many years ago, probably about 20 years ago, and they said that our son, I think it was about 8, is on the soccer team in the private school he was in. and he was being kicked off the team by the coach because he couldn't compete. His energy just wasn't there. And did I think I could get his energy back?
Mm-hmm.
And I said, well, I mean, I don't know. It depends on exactly what the problem is.
Right.
But I said, the first thing I want to look at is diet. And they said, oh, he's on a perfect diet.
Perfect.
And I said, okay, he's on a perfect diet and he has no energy. By any chance, is it vegan? And the dad said, yes, we are all vegans. And I said, well, in that case, I can almost guarantee you I can get his energy back now that I know what's probably causing it. But you will have to be willing for him to not be on a vegan diet, and he will have to be willing to not be on a vegan diet. He said he loves soccer. He hates the fact he's been kicked off the team. We will do anything you want. And they made an appointment.
Okay.
And so they come in to see me. And I, went over what I consider to be a healthy diet with, good quality non-starchy vegetables and, not too much fruit, mostly berries, and adequate amounts of all of the properly raised meats. And with him, I wanted that to be the red meat because I wanted to get all of that energy back in fast. So I wanted him on grass-fed and grass-finished lamb, grass-finished and grass-fed beef. And
now how much?
And I said, basically, I think he weighed maybe, God, I don't even remember, maybe he weighed 100 pounds.
Mm-hmm.
I said, so let's have a 4 to 6 ounce portion with breakfast and dinner. And they said, would it be healthier if it was raw? Because they've been on a raw diet. They were on a raw vegan diet.
Ooh, okay.
And I said, yes, it would be healthier if it was raw, but we're going to have to make sure it's organic, grass-fed, grass-finished, so there won't be any bad, stuff in there.
The hormones.
And because they were a fanatic, that they remained fanatical, and he went on raw.
Okay.
And they got grass-fed, grass-finished beef, lamb from Whole Foods or other local places, and he ate it raw. They made steak tartare and lamb tartare and all those various different things. And they called me. I said, I want a phone call in 30 days. They called me up in 30 days, and they said, we were just going to call you up to say how much better he's feeling and everything. But really, it would be more appropriate to tell you what we just got a phone call from his coach, because he's back on the team. And the coach said, what the hell are you feeding this kid? He's now outperforming everybody on the entire team.
Oh, my goodness.
Are you sure you don't have him on drugs?
Yeah.
And they said, no, we just have him on food. What food? Well, raw beef, raw lamb, raw eggs. Oh, my God. So after they saw this change in their son in 30 days, when they came in for his next appointment, they said, we sort of feel like maybe if his diet was so deficient that this could make that much of a change, maybe we shouldn't be vegan either. What do you think?
What do you think?
And they switched over also.
They switched over.
And I said, you don't have to be that fanatical. It doesn't all have to be raw. We said, yeah, we understand that, but we've used to. I said, if you want to cook it, cook it medium rare.
Yeah.
But yes, everybody started feeling better.
Yeah, because I have a lady who is actually a physician herself, and she was the same thing, vegan. I'm feeling very, very tired, no energy, just could not keep going. And not only that, she was beginning to be very, very sluggish. Well, that's the no energy. Her memory was getting shorter, and she was having some panic attacks and cardiac palpitations.
Right.
And she said, well, I know you're going to suggest I have the B12 shot. I know you're going to suggest I go eat some meat. But I said, I'll eat the meat. I'm not going to take the shot, because she was afraid of needles.
So give her a B12 lozenge. They work really, really well.
Yeah. So I do have a sublingual.
Yeah, okay. Yeah.
It's a sublingual B-complex B12 folic acid.
Yeah.
It's very good from one of the health food stores. Put a couple drops under your tongue, and you really can feel it. But she did that. She said one small portion of grass-fed, grass-finished beef, she felt like she had a B12 shot that lasted her a month. So she only had to do that once a month, and it would hold her.
Right. But what I always tell people is that our body doesn't like we're almost deficient. Let's take some and get back up again. Okay, we're almost deficient. Let's get back up again. So medical doctors like being liked. We all like being liked. Let's be fair. We all like being liked. So the MDs generally will give a B12 shot so far apart, like every 6 weeks or every 8 weeks.
So you can
that
come back.
Right, that the person is already feeling like, oh, doc, I need my B12
I
shot.
just made it in here
Yep,
again
you
for
give them their
another shot.
and they feel, oh, great, I feel so great, thanks a lot. And I always say that means your doctor cares more about being liked than about your health, because I want your B12 level to stay high enough that you never begin to feel like I need it.
Yes.
And so I put them on a sublingual B12 lozenge, and they never need the shot again.
Very good. Very good. I like the liquid too, so
Yeah.
I'll check on the lozenge as well. But now other nutrients that are somewhat deficient in doing the tests on vegans, and we want to try to hit the nutritional value that's being depleted because of being vegan is very important. And sometimes people, you can almost look at a vegan person who are not a vegan versus a person eating meat, but a person eating meat that's not grass-fed.
Right.
Their skin look like it's oozing out of toxins. And I see that from the ones who are eating meat, but they're not eating grass-fed, grass-finished. You don't want all the hormones and the pesticide and the animals eating the other animals. It's just horrible.
Right. Clean as we can get it.
You know, that's why we have such a bad relationship in this. A friend of mine, I went to, he's a doctor, we went to lunch, and he was telling me that I just saw knives over fork. I don't want any more meat. I'm like, really? Okay.
Anytime somebody says, I just saw knives over forks, I go, you can't investigate a topic from one side.
Exactly.
You have to investigate a topic from all sides and then make your decision. I'm not trying to push you into a side. I'm just saying, listen to both sides. So the best movies on the other side of that issue are In Search of the Perfect Human Diet by C.J. Hunt.
Okay.
He did a fantastic job. He traveled around the world interviewing the research scientists and getting information on what did we originally eat. Also, fantastic documentary, In Search of the Perfect Human Diet. And a second one, which I don't like the title of as much because it's going to turn people off and they won't watch it because of the title. But nonetheless, the title is We Love Paleo. So I would suggest people watch In Search of the Perfect Human Diet. And then if you want some more, We Love Paleo, just so you get both sides of that issue and see where it looks like most of the science is. Because the vegans are often giving you information which is not backed up by science. And that pisses me off. You know, somebody will say something and they'll say the research shows, and then I go looking for the research and it's not there. And then there was one woman, Leetv Keith, who wrote a book, The Vegetarian Myth, and she became vegan. She listened to a lecture, you know, how terrific it is and how much better it is for you and how much better it is for the planet, all of which is false, which we'll hopefully have time to go over. And she became vegan. And over time, her health started to go in the wrong direction. And I'm trying to remember when I interviewed her, it's up on my site, I think she said one day I had an urge to have some red meat. And I had some red meat. And I felt better the next day. And she's I think I remember her saying that she said to herself, wait a minute, if vegan is such a healthy diet, why did I have the urge? And more importantly, why did I noticeably feel better the next day? And she started looking at research studies. And she found over and over and over again what she had been told by the person at the microphone behind the podium about the research was not what the research she found said. And so her friends said, well, you're a perfect person to write a book, because you did the vegan diet, you went on it, you didn't feel as good, you switched back, you went, well, wait a minute, if it's so good, how come this is not happening the way it's supposed to?
Exactly.
You looked at the research study, you found out they were wrong, write a book. And she said, I'm not an author. No, you're the perfect person. Finally, they coerced her, I guess, into writing a book, The Vegetarian Myth, and she did a very good job.
Now, I do want to say that one person I was really surprised had a raw diet. Obviously, everybody's genetic makeup is different.
Absolutely.
So we have to look at that as well.
We don't want to look like each other, do we?
That wouldn't be any fun.
No, that'd be boring.
But this particular person is a male, and he's well known for his raw food diets.
Sounds like Gary Null.
No, it's a Keaty.
Okay.
Keaty. Yeah, I know Gary Nell told. Well, then but this person, and he told a story. We knew he had an accident. He had an accident where he was kind of smashed between two cars.
Okay.
And he had broken bones. He was unconscious for a minute. He went through a lot. He told them at the hospital, I don't want any medication. Don't give me any drugs. Give me nothing. I'm not having any type of surgeries. He healed completely. He came to me. He said, I want you to do my lab work. We did micronutrition testing. We did everything, and it was all normal.
Normal.
It was no, it was actually in the functional range.
Was it better? Okay.
Yeah, he was in the functional range.
Better than normal, yeah.
But he's one out of the what percentage?
Right.
That can live that kind of a diet. Being a raw food.
Mm-hmm.
I think 80% of his food or more is raw, but Akiti he really pushes that, but he looks like it. He works out. He's healthy. He's in the sun. So you can't just say the food. It's got to go along with everything.
Right.
What's going on with you emotionally, your surroundings, the EMS that we talked about on a show. You got to look at the whole picture.
One of the things that people don't understand, and it's fairly important, and it never gets discussed, is that there's a very big difference between a therapeutic diet and a long-term diet.
Yes.
And so the example I give, just to be forceful enough that nobody can misunderstand me, is take a person, and I met somebody that falls into this category. Take a person who has never felt good for years and years and years and years and years. And all the doctors that they've ever been to have looked, and everything looks totally normal, and they have no idea what's going on. Everything, everything looks fine. And then one doctor looked at it one day, and this is a story I was told, and said, your white blood count is at the low end of normal. I wonder if you've got a chronic long-term infection, and nobody's found it. And so we're going to put you on intravenous antibiotics for 2 weeks and see what happens. And so they put this person on intravenous antibiotics, and by the end of 2 weeks, she felt totally normal. She felt the best she's felt in 20 years because they found some possibility and knocked out a long-term infection. Now, my question is, since that was what made her feel fantastic, should she be on IV antibiotics for the rest of her life? No. So just because going on a vegan diet for a month that luckily cut out some crap that you were eating,
a lot of crap,
and you started eating some healthy foods you were deficient in, and you now started feeling better, just like the antibiotics made her feel better, that doesn't mean that everything is in that and that it's a long-term diet. Because the only way we can validate a long-term diet, Price saw this, Pottinger saw this, the only way we can validate that a long-term diet really is healthy, and we now know this because things can get worse from generation to generation, is to find a 5th generation or further person who has been eating pretty much that way and still is free of disease. And that's what Weston Price did. He went around the world looking at people that had been eating the same way for thousands and thousands of years, more generations than anybody could count, and were still in perfect health. And if somebody can find me a 5th generation vegan, which I believe is impossible because they would have lost fertility way before that, then I will believe that that's possibly one of the various diets that's healthy.
I love the story that he shows with the cat.
The Pottinger cat story is fantastic.
The Pottinger cat. I hope you can find it.
Pottinger's Cats, A Study in Nutrition.
It is phenomenal to show those cats that from generation to generation, and that's what happened to people's teeth. Right. And they wonder what's going on with their teeth, and who are vegan and don't want to do dairy and not doing this, not doing that.
Yep.
It shows.
It shows.
I had one patient who was terminally ill, and he was vegan. Mm-hmm. And the wife called me. She said, what can I do to help him? And I said, well, you can make him my drink.
Your liver and herb drink?
The liver and herb drink. And she said, but he's vegan. I said, but he can't get out of bed, and they said they're not going to do any more blood transfusions. Why would you want someone else's blood when you can take something food-wise? Right. This is not. It's not a quick fix. It is a quick fix because you're going to feel good, but it's something your body is lacking all along because you've been vegan all your life, so it's very low. So what happened with him? She brought him to the bedside and gave him this every day, 3 times, 4 times a day. Because I set it up so it stayed in the system. And do you know, about the 4th or 5th day, he went into the refrigerator and saw this and had a fit.
When he found out what it was?
Yeah.
He saw the liver?
Yeah, he had a fit. But I'm like, you're feeling good. You're up. You're back riding your bicycle. And you were bedbound.
It violated his cult.
Thank you. And, he went back to his old way of eating, and he passed away.
Mm-hmm. Oh, yeah, I've seen that.
I said, I can't believe, why would a person do that? And you're feeling good. You're feeling good, but if I do your blood test, I'm going to see that. And to let people know about iron, as we go more into a little bit more nutrition, to let them know if they're, anemic or the iron, what things need to be placed there, like the vitamin C, so that you can that can be facilitated and absorbed into the body properly. So I'm going to let you sort of go a little bit more into that. But it's important that a person know if you're going to eat spinach, you're going to eat things, even with your vegan foods, then you want to maybe have some lemon with it or do some other things, or even with your juicing. Make sure you have.
Yeah, juicing is a good idea because when you pull the fiber out, now the body can access the nutrients much, much better.
Right, and you can put the lemon in there.
Yep.
And then you have to make sure your HCl is on board too. So you're getting, it's absorbing and being utilized by the body properly.
I've had people that have come up to me. It's happened at Whole Foods a couple of times because somebody recognized me from a movie I was in or something and said, "Oh, you're the low carb guy," and every time I open my mouth, I want to teach.
Yes.
So I look at them quizzically and I go, "I'm the low carb guy, huh? No, I would never want anybody to eat less broccoli, cauliflower, Brussels sprouts, asparagus." And those are all basically 100% carbohydrates. So what do you mean?
Low carb.
And of course, people use the word carb incorrectly. They don't understand that every vegetable is a carb.
Yes,
what
it
they
is.
really mean is low starch, low sugar, low alcohol. And I trademarked a term I made up a bunch of years ago. I call them all sabotage foods
Yeah,
because they sabotage the body.
Yes, they do.
But I remember somebody coming up to me and saying, "What do you think about the raw diet?" And I knew what they meant because it's always vegan.
Yes.
But again, I'm trying to educate. So I said,
Yes.
The raw diet. Well, I think the raw diet is extremely healthy, but because if you go back in time to prior to when we ever knew how to make a fire, all Homo sapiens on the planet ate everything raw. So they ate the elk raw, and they ate the buffalo raw, and they ate the fish raw, and they ate the birds raw. And if they were able to find any non-toxic plants, they ate them raw too.
Yeah.
So I guess I liked it. And their faces changing because they didn't mean those raw. They
I
meant
know.
the other raw. But everybody has their own idea
Yeah.
of what's good. But as far as deficiencies, we have a belief system because we're given it by doctors mostly,
Right.
that there are certain amino acids that are required for health.
Exactly.
And they're called essential amino acids.
Exactly.
And the Food and Nutrition Board and the government has said that as long as you get all of the essential fatty acids, all the essential amino acids, then you have a complete protein. The problem, and the vegans don't understand this because it's not being said from the lecture hall when somebody's lecturing to them.
Exactly.
The problem is ratio makes a big difference. So if somebody says, well, but if I combine my beans and my grains, then what was missing here is brought in here, and I've got all the amino acids, and it's a complete protein. Well, yes and no. If you have a tiny amount of something that was missing, and now it's there, then you're not deficient as far as it's there, but you're deficient as far as how much your body needed it. It would sort of be like if you dumped a whole bunch of stuff outside for somebody to build a little house for you. And you gave them nails and screws and boards and plumbing and wiring and all the stuff you needed. However, one of those things, let's say screws, you only gave them about 1/10 of what they needed.
Right.
It would be correct to say all of the substances that are needed to build the house are there, but not enough.
Won't be complete.
And that's what happens when somebody thinks they're getting a complete protein on a vegetarian or vegan diet. Yes, some of that is there and some of that is there, but we evolved eating animal foods where there was enough of all of those amino acids, and when you do it with plants, it's not the same. And so even if somebody says, I've been eating this way for 20 years, usually it's much less than that because by then they're falling apart. But even if somebody's doing such a good job, they understand they have to bring in these kinds of seeds and these kinds of nuts. They know which fats are good and which fats are bad. And they're doing a better job than most vegans. And they're still fine. At some point, they're not going to be, if it's long enough. And it'll never be, in my beliefs, multi-generational, which it would have to be able to prove that it's a healthy long-term diet.
Exactly. And what's interesting to me, years ago, I still hear some people say this. We're on a vegan diet, but you drive through McDonald's and you're picking up French fries. Yes, it's a vegetable, but that's
sort of.
Well, it's not even a vegetable. Not from. I shouldn't even have said names, but you have to be careful where if you're eating all starch and all French fries, that doesn't mean you're on a vegan diet.
No.
And I've had some people say that.
Right. And basically what you're saying, which is true, is that there are a massive number of different foods that would be classified as vegan that are horrible quality foods.
Very, very bad. Very bad.
I mean, somebody could be eating candy bars that are vegan, and somebody could be eating garbage quality, wheat products that are vegan and horrible pasta. I mean, there are a lot of things you can get that would be vegan if they're made that way that are horrible for everybody.
Now, what about calcium? Because we know that I know one of the doctors, I'm sure you know him as well, who have written a book on death by calcium, Dr. Thomas Leetv.
Yeah.
People who are vegan, do you think they're getting too much calcium?
I don't know whether they're getting too much calcium. I think the problem is that when we get a lot of calcium, even in a supplement,
I mean, they're not getting enough. I meant to say they're not getting enough because the vegans won't do
because
the
they're
milk.
not getting dairy and
They're not getting dairy,
okay.
but they'll do the almond milk and the other milks. And what happened? Those are fortified,
Right.
so that means they wouldn't put some calcium and other nutrients into those,
Which is
milks.
a different form than they would have gotten if they were getting it in real food, in
real
in
food.
meat or
So
in bones or something else.
You could do. To me, I like almond milk, and I do some.
Right.
But you can't just do glasses and glasses of almond milk, because what are you doing? Because you're not getting really the right form of calcium to go into the body.
The biggest problem was when they allowed something that doesn't come out of the nipple of a mammal to be called milk. Because
Yes.
milk is a whitish liquid that comes out of the nipple of a mammal to be the sole sustenance of its young when it's born. And that does not, almonds don't feed their young, soybeans don't feed their young, and rice kernels don't feed their young. And therefore, those are all drinks, not milks. But when they put the designation milk on them, people are using them as a substitute for a whole food, and it's causing problems.
And
So,
they don't
yes.
taste like milk. Only reason I know that is because my daughter told me, because she's breastfeeding, that it really tastes like cantaloupe juice.
Plus, of course,
So
even the
it's-
milk that we're getting has been bastardized so much that it's not
Oh
milk
my
anymore.
God,
I mean,
yeah.
I am so happy that we are doing this in Southern California, because
Yes.
in California we are one of the states in which raw milk is legal, and so we have organic pastures dairy and Claravale dairy, which have grass-fed, raw, and organic pastures is also organic raw milk available in the stores, and I drink an average of 6 quarts a week. Which is why I'm obese, and because there's a huge amount of fat, lots of protein, but it's raw. The body uses it very, very well.
Yeah,
easily.
and I've been knowing you for a long time, and each year that I see you, your skin just glows. You look very healthy, and you can see this.
Yep.
Actually, what a person is putting in their body internally, it will show through the skin.
Makes a big
So when
difference.
you're eating a lot of toxic foods and a lot of toxic meats, you can see that through
Yep.
the skin. You can actually look at the sclera of the eye, the white of the eye,
Right.
and they're not white
Right.
because of the diet. So you see a lot of things start changing in the skin. And that's why a lot of people have told me, oh my goodness. And I have a very dear friend, I will say her name, because she made it a point to tell people, she looked great for her age, absolutely beautiful. She's going to be coming on the show soon. And that's Dr. Barbara Young. She's a beautiful woman. But you know what? She said, I'm not vegan. She said, I have to have some meat. I have to do meat.
Oh, yeah.
So,
I had a woman come in, and the entire this is the only time this ever happened. The reason she came into my office is because she had an unhealing, it just would not heal, gash on her leg. I don't remember what caused it, and it had been there for a year. She'd been to numerous doctors, numerous dermatologists, and it just nothing would heal.
Yeah.
They gave her different salves to put on it, all sorts of different things. She comes in, I take a look at her diet,
look at the diet.
and she's on a vegetarian diet.
Exactly.
And she was basically on an almost vegan diet. And I said, it's not healing because protein is what the body is made of to build.
Exactly.
So we put her on a whole bunch of good quality animal protein. She comes back in 6 weeks. She walks in the door and she says, I just want to let you know I'm furious. And I said, hopefully not at me. She said, no,
No.
not at you. She
No.
said it's healed. She said
Yes.
after 1 year of multiple different doctors,
Doctors,
she said,
yes.
none of them asked me anything about what I was eating. None of them.
No.
You take a look at my diet log, which is required. You say, I can see why it's not healing.
Exactly.
You up all the animal products, and it's all healed. She said, that's disgusting. How can they not know any of that? And I just said, welcome to my world.
Exactly. You and I say that all the time because it's been, and I have to take a breath on that because it has been really difficult. Especially those who don't want to change, I tell them then we're not compatible to work together.
Right.
We're just, we're not. I can't force you to do anything. I'm not going to force you.
Right.
And I told them this is a team effort. We work together as a team. I'm going to show you, and I'm not the head of the team. We work together as a team because those are changes you have to make. This is your body, your temple, and this is what you want to do to sustain your life. But we're almost out of time, so I want you to, and we have so much more to say, I know. But if you can kind of wrap some things up, what do you want a person going away leaving from you today?
Okay.
As we spoke about vegan.
Right. So I want them to understand that we don't have any long-term vegan societies to validate that it's a healthy diet. It simply cannot be validated at the moment, and I don't think it'll ever be because I think they'd lose fertility. The people that say, well, I'm vegan because it's better for the planet, that has been disproved so many different times. Agriculture and clear cutting and everything are destroying the planet, not raising of cattle. If you'd like to look at that further, please go online and find Alan Savory and take a look at some of his videos where he is re-energizing the earth by bringing cattle back in a proper rotating basis, which is amazing. Read Lierre Keith's The Vegetarian Myth, and just make sure that you understand that if you want to be vegan and you're doing it because you believe it's healthy, you must look at the other side thoroughly enough to find out whether the people on that side are correct or whether you're being misled. Because otherwise you'll get very, very angry when you find out they're wrong. And I want you to get very, very angry before you get so badly hurt that it's really hard to reverse it.
And people, if you really look at the fact, people will say, I went somewhere and I craved this. But, you craved it because the body wanted it. The body
Except sugar, because that's an addictive food.
That's addictive food.
That's like people crave sugar, crave cocaine, crave heroin.
No,
that doesn't mean you
that's
need
different.
it.
I'm speaking of foods that are nutrition. And actually, when your body is more balanced nutritionally, you really want good food going into the body. You really don't want sugary foods, and you don't want those things when you start eating clean.
Right.
And you have a clean colon. So in eating a vegetarian diet, have you seen, real quick, because I know we're about to wrap up, because of what's happening with our crop, vegans, I had several people who have called me, one in particular, said my relative was vegan for years and now he has cancer.
Right.
So what's happening with our food crop and the GMOs that are sprayed on the vegetables, if you're going to do all vegan, what type of protection are you going to have?
Very, very hard to do that because Roundup, Monsanto's Roundup, that has very good research on how bad it is.
Yeah.
And people are calling it glyphosate. That's incorrect. It's the inert ingredients. Cherilyn Lee has found it's what's listed on inert.
Yes.
Is even more toxic than the glyphosate part. But the point is, it's sprayed everywhere. So they're now analyzing organic foods, all over the place. And even though it's much less, it's the best we can do.
Exactly. Exactly.
It's still there. So we're exposed to things. And when somebody eats way more of that, we're exposed to way more of that. So between all of the amounts of Roundup you're getting, all of the pesticides you're spraying inside your house because you don't like that cockroach, so let's kill my family because we want to kill the cockroach, I don't spray any of that stuff.
So
ants, it's very, very
There's
hard.
some natural things you can do for ants and bugs, so we can get into that on another show. But we don't want to do that. But I want to thank you so much, David Getoff. You're a one and only on this planet. I want to say that you have so much vast information. You attend. I need to follow with you to some of the workshops because some I've been missing because I've been so busy in the clinic. But I really love attending. But the information that you bring to the table is very earth-shattering to the point because it's going to help a person say, think.
Yeah.
All you need to do is just think. You don't have to trust us in what we said.
Yep.
Just think about it yourself. Do your own research.
Yep.
But basically, your body will tell you how you feel. You've been like this so long, you think I feel great. That's the sad part. You've been feeling like this so long, you don't even know what feeling great look like.
Right.
So people ask me, what do you do? Because I'm full of energy all the time. And it's because of what I'm doing.
Right.
It's what I like to do, is what I'm doing, what I'm eating. I love organic glam. That's just me. I love it. I do have 90% of my diet is vegan.
Okay.
or not vegan,
Organic, yeah.
It's definitely organic, but I still do my vegetables. I
Yeah.
do have a lot of
I eat
vegetables in it.
non-starchy.
Yeah, non-starchy. And so I just want to say that really don't take our word for everything. Don't take everybody's word because something's going to pop on the news probably tonight after my show. You're going to see it on the news, but research it for yourself. Look at behind the person who is saying this. You know, what is that person's background? What is that person's belief? Because whatever their belief is, trust me, that's what's going to fuel the writing of that book. So be very careful. Use your own knowledge. God has given you your own brain and your own sense. So utilize your own. I want to say thank you so much for tuning in today to another episode. And as I always end my show, always know too that gratitude is very powerful. But so is the I am. The I am. So repeat after me. I am so grateful that I am a magnet for miracles. That's why I know that's why I know David Getoff, because I'm a magnet for miracles. I draw in good people, as you know that. So take care. Love yourself and love someone else. Give someone a smile. It's free.
Join us every Wednesday live at 11 a.m. for NuWellness TV with Dr. Lee. Remember, healthy mind, healthy body.